Hey, I'm Dr. Kyle Konis with Shift Health Center. And a lot of people wonder, how can we reverse chronic conditions without the use of drugs, surgery, or injections, even if you've been told there's nothing that you can do or that there's no hope for what you're suffering with, or if you've tried 100 other things that doctors have told you would work? Well, a lot of people ask us that question, and I want to break that down, our process and how we've gone about tackling that. So really how we came about this, when we first started seeing patients and first started treating patients years ago, it was kind of trial by fire. We were doing lots of things, and sure, patients were getting well, we were getting a lot of cool results, but it was more so just kind of throwing things at the wall and seeing what stuck and trying to learn from that and continually enhance and refine it. But I wasn't really happy with that process because frankly, it wasn't as predictable in terms of getting results. And so between countless hours of going to seminars, doing extra learning, staying on top of the latest research that's out there that comes out, and how can we incorporate that clinically, and how can we better serve our patients? Trial and error with patients that we do have, what worked, what didn't work, what were commonalities and common denominators that we saw between patients. We had to figure all of that out. And through that process, we've really come up with a comprehensive list or algorithm, if you were, that is now very predictable, and we're able to get even better results, which has been really exciting. And so if I could kind of break this down, what I would say is the first step in our process is what's called identifying the core dysfunction. All right. And when I say core dysfunction, think of that like the root cause of what's going on. Too often, unfortunately, in healthcare, we see people just get so wrapped up in symptoms, right? And this can be the patient or the doctor. So maybe say you've got numbness and tingling and burning in your feet, maybe from peripheral neuropathy. Well, a very common treatment for that is just to give someone gabapentin, which is a prescription medication that essentially tries to disconnect your brain from your nerves so you no longer feel those symptoms. Now, I don't know about you, but taking something that's just going to numb me from what's going on in the rest of my body probably isn't getting me healthier or actually fixing the problem. We didn't identify the core dysfunction that's actually causing these symptoms that are happening in our feet or hands. So that's a really important aspect, right? Same thing if we have low back pain or headaches or any condition that we have going on. The question is, what is the core dysfunction? What's actually causing and driving this at the root cause? So the first step is actually being able to identify that, because if we don't, we're never going to be able to put a solid treatment plan going forward that's actually going to reverse this condition. Now, the second step in the process here is what we call tissue transformation. And tissue transformation means, hey, once we've identified the tissues that are damaged and causing these problems at the source, how can we go about transforming those and fixing those tissues? So a good example of this would be if you go to the gym, right? You go to the gym, you want to get stronger, look leaner, whatever that is. Number one, unfortunately, that doesn't happen overnight. You can't go to the gym once today and wake up tomorrow with a six-pack. I wish you could, but unfortunately, that's not quite how it works. And so we know, though, over time, if we put the right nutrients into the body and we put the right stimulus into the body, we put the right therapies, the right nutrients, all of these things that we need to do as a comprehensive package into the body, we know that we can transform those tissues over time, and we can get that six-pack or get the biceps or whatever we're trying to do. Once those tissues are transformed, only then can our body again function normally, and we've then fixed the root cause of what's going on. Now, the third step to this is optimization. We call this lifestyle optimization. All right. So most patients, when they come to us, they're sort of in crisis mode. It's like a fire that we have to put out, right? So no matter whatever that symptom is, debilitating headaches, back pain, neck pain, peripheral neuropathy, it could be any of these type of things. When we go through these steps, first, it's like, all right, let's get this problem under control. Let's get this fire put out. And that's the first step. And that is a great start. But from there, we need to optimize things so that people can live long and healthy and strong into the future. So a good example of this, if you think of a guitar, right? So you could be playing a guitar, maybe a guitar string breaks. So now we have a broken string. That guitar is essentially not playable anymore. It's in crisis mode. It's broken. It needs to be fixed. So we can take that broken string, take it off, put a new guitar string on, and now you look at the guitar, it looks great from the outside. You look at it, hey, that guitar looks pretty healthy, if you will, right? It looks like it could be picked up and played. But the problem is, what if we don't tune that guitar? What if we don't go through and fine tune after we put the new string on? Well, it's not going to play good music. It's not going to sound the best. It's going to be functional, but it's not going to be great. And so that's what lifestyle optimization is. If we go through and we fine tune that guitar, now it can produce harmony. It can produce beautiful music for years to come, right? And that's the same thing with the body. Once we put that initial fire out and get some of the symptoms under control and start reversing conditions, Well, now how can we tweak and optimize and look at things like sleep and diet and nutrition and supplementation and these different aspects, mindset, and that allows us to really, what I like to call, age gracefully and be more proactive about our health into the future rather than reactive. Okay, so when you put these 3 steps together, identifying the core dysfunction, tissue transformation, and lifestyle optimization, we call that the shift solution. And that is how we take care of our patients and get the amazing results that we get. And when you put all 3 of those together, it unlocks the healing power of the body. Not only can we put out the short-term symptoms, but on top of that, we can live long and strong for many years to come and live life as we should. That's really the goal and what we want to be doing. So if this makes sense, you like what you're hearing, this sounds like it could be a good fit for you, I encourage you to click the new patient special offer button or request an appointment. And that way we can speak with you and see, is this a good fit for you? Is this a good fit for us? We have to have both sides of the coin there in order for this to work. So we have to make sure that your condition is in our wheelhouse, and you have to make sure that we are potentially a good fit for you. But I encourage you to go ahead, click that button, request an appointment, and we will talk to you very, very soon.